Hello, I'm Joan. I'm a Canadian family physician who also works as a restorative medical educator, facilitator, and coach. I create spaces that rehumanize the work of healthcare. I'm creating this podcast to remind myself, as well as anyone else working in a helping profession, that when you are working and caring for your human patients, you are the other human in the room. Hey there, healthcare human. Today's podcast guest is a fellow co-founder of the Hippocratic Collective, a brand new podcasting network made by physicians for physicians. I am thrilled to announce that the other human in the room is joining the Hippocratic Collective alongside other physician creators who are inspired to use their voice to humanize healthcare. Physicians need to be heard, not just consulted. Together, we're here to change that. Visit hippocraticcollective.org to learn more. Hello there, healthcare humans. Thank you so much for coming back for another episode of The Other Human in the Room. I am super excited for today's episode. I'm very curious to hear this healthcare human story. I've only heard a little teaser and it intrigued me so much. I said, hello, would you like to come on my podcast? So just a bit of background. Lauren, who you're going to hear from in a minute, her and I have met once by Zoom and that's it so far. We're going to be a part of a collective of physicians who are helping to support other physicians do certain things, but I won't get too much into that at this point, but you'll be hearing more about that later. But for now, the thing that really intrigued me was when Lauren introduced herself to the group. And one of the things she said is that she got, I think it was 10 months into a 12-month fellowship and quit because of the circumstances of it. And I thought, well, if she's willing to tell that story, I am willing to hear it. But before we jump right to that particular point, Lauren, would you like to introduce yourself? What would you like people to know about you?
Yeah, thanks for having me, Joan. I'm excited to not really to talk about it,
Yeah.
but I do wish I had had a resource going through that big challenge in my life. We'll just say it that way. And so I am happy to serve as a resource for other people
Mm-hmm.
who may encounter challenges along their career path. So I'm excited to chat with you today. My name's Lauren Umstattd. I'm in the greater Kansas City area, so I'm a south neighbor of you.
Yes.
I am a facial plastic surgeon, so I specialize in cosmetic surgery of the face. Think like facelifts, blepharoplasty, brow lift, that type of thing. I started my own business about 2.5 years ago. So I have my huge office here. We have a clinic, a surgery center. I have about 10 employees, and we're just rocking and rolling, which is pretty crazy that I just had the audacity, confidence, however you want to put it, to open my own practice right out of
Yeah.
fellowship. And then I'm also busy in my home life. We have two little boys. I'm married. So yeah, I feel like I'm go, go, go all the time.
All the time. And we have the two boy mom thing in common. So how old are yours?
They're 4 and 6. And
Yeah.
I saw a video this morning talking about some research study they did. They actually showed that boy moms' telomeres shorten faster than girl moms,
Oh no.
strictly based on like the amount of like testosterone you're exposed to and like when they're in utero, the amount of physical activity and like
Oh,
just rambunctiousness that we deal with. And so send in a little extra love to all of the boy moms out there because we do actually age faster, one study has shown.
that is fascinating. And I do have those grays in my hair, so that may be some proof over on my
Mhm.
side too. Oh my gosh. I would love to hear a bit more about your journey into medicine. Like what were some of your driving forces that brought you into this profession?
I think very early on, I loved science and math. That was just the subjects I gravitated towards. I thought that I wanted a challenge every day, and so medicine certainly fits that. I also love the human component. And so I was one of the weird ones that kind of from a very young age knew I wanted to go to medical school. I didn't really know what I wanted to do, but
Yeah.
I just knew that going into the human world with lots of science is something that appealed to me. And then, once you get into medical school, you have this thought of what you want to do or be, which changes dramatically for most people. So,
Mm.
um, but yeah, I think the human component as well as the science component. I just can't imagine a career that does that better than medicine.
Yeah, oh, for sure. And so then what was it about plastics that drew you to that specialty? Or is there, I don't know how it works in the States if there's like multiple steps before you decide on facial plastics specifically.
Lots of steps. And I will
Yeah.
say that one of my mentors is actually in Canada.
Hmm.
He's in Toronto, but most facial plastic surgeons actually do ENT training first,
Oh, okay.
which similar to your Toronto buddy up in Canada. But most of us do, surgical training in the head and neck for 5 years
Mm.
after medical school. And then we go on to do a fellowship in facial plastic and reconstruction, which is either cosmetic stuff up here, reconstructive stuff up here, but we're really the head and neck specialists.
Mm.
And so in medical school, I fell in love with surgery. I loved like the anatomy and intricacy of the head and the neck structures. I loved that you had to operate through all these tiny little holes, try to get creative
Yes.
about your incision placement. And it's such a functional area, such a cosmetic area that even when you're not doing cosmetic procedure, there is a lot of focus on cosmesis.
Mm.
So if you're taking out a large tumor in someone's neck, you, there's a lot of attention to incision placement by head and neck surgeons so that once you're all healed up, we can limit the functional and cosmetic, sequela of the surgery. And then in residency, we see a huge range of pathologies in the head and neck. We see kids, we see much older patients, we see these horrible, devastating, traumatic injuries,
Mm.
we see really complex malignancies, and then we get to do the fun stuff like cosmetic surgery. And I fell in love with cosmetics because people want to be there, they're
Yeah.
motivated. It's not like a sad thing. It's like an exciting thing. Like, let's invest in yourself. Let's get you a little bit refreshed. I don't know, it just clicked.
Mm.
And so I'm so grateful for all of the big cases I did during residency. And I'm also glad that I don't have to deal with a lot of those like sad situations anymore.
Yeah. Cool. So then tell me a bit about your training then. So what was it like going through surgical residency and was that like a really relaxing, wonderful, humanizing time for you? Or are you more similar to most people I talk to where one of the things I talk about a lot is how, yes, society has a lot of messages in it that are dehumanizing, but within medical training itself, we really have some of our humanity trained out of us. And does that resonate with you at all?
Oh, for sure. Such a loaded question,
Yeah,
Joan.
rather leading, but you know.
I would say surgical training is not for the faint of heart. And background. I was a competitive gymnast.
Mm,
I was a Division 1 athlete. So I read this book a few years ago called Grit by
yeah.
Angela Duckworth. And, certain things in life take a lot of grit. And I would say that surgical training is right there at the top of the list. And I would describe myself as a very like gritty person.
Yeah.
I can put up with a lot. Because from such a young age, I just did stuff that was not enjoyable. That sounds
Mm,
horrible to say out loud, but I think when you do really complex things from a young age, I would categorize gymnastics as that.
oh yeah.
It trains into you this like discipline, tolerance for pain, delayed gratification, all these like things that are helpful when becoming a surgeon. I think residency I looked at as a means to an end.
Yeah.
I knew it was gonna be no walk in the park, and I think I just had to tolerate a fair amount of discomfort and mistreatment, you could say.
Mm.
I also recognized that I had to do it. You have to do residency if you want to get to where you want to go.
Yeah.
There's not a lot of option. I mean, from an outsider's perspective, they could say, well, can't you just switch programs? That's really challenging. And often you incur a delay in training. You have these huge loans that you're having to like pay on. And so you're kind of trapped. Like wherever you match, you just kind of have to get through it,
Hmm.
and make the most of it. But my surgical training was complex. I would say there are multiple challenges. One is just scheduling. You have zero control over your schedule.
Yeah.
And I married into a family that there are no physicians. And so a lot of times they didn't quite understand, like, well, what do you mean you can't come to this birthday party? Or what do you mean that you're too tired? You don't want to come to this thing, like you're not working.
Mm.
And so that was kind of a delicate balance, I would say. Um, Also, just physically demanding.
Yes.
You know, some of the cases we did were 9, 12, 15-hour cases that you get these like little breaks to like go out, pee, eat a granola bar, and run back in. But the physical demands of residency are certainly there, especially with sleep deprivation and just cognitively ensuring that you're pushing yourself to continue to make good decisions, even
Yes.
when you're not your best. Um, I had some amazing bosses or attendings and mentors in residency, and then I had some that I didn't really care for, which was nice in residency because there's like a nice pool.
Mm.
You can swim away from the people that you don't love and swim towards the people that you do find more mentorship from. Um, and then I got pregnant. And
Mm.
so that was a huge challenge that, was my own doing during residency.
And what is it like, or what was it like in your program regarding like residency and maternity leave? I know I'm just even aware in the States it's sort of different lack of standards for maternity leave type stuff. So how was that sort of transition out and into your program received by your program?
So it was a planned pregnancy.
Yeah.
Before I decided to get pregnant, I looked in our handbook and I did have the verbiage memorized at one point, although this was almost a decade ago, but it said something like the title was maternity slash paternity leave. And it said each resident will be allowed 3 days maternity slash paternity leave.
Oh my God.
And then you may use vacation time in addition to that. And so I said, okay, well, we get 3 weeks of vacation. So when I get pregnant, I'll just work up until the day I deliver. I'll take my 3 weeks of vacation and then I'll come back to work. And then there was nothing in the handbook about breastfeeding or what if you go
Yeah.
on bed rest beforehand. I also was pretty naive. I didn't quite understand like how physically different you are when you're pregnant and postpartum, because I had never done that before. So when I got pregnant, I hit like the 12-week mark, and all of us moms start to like sigh, sigh of relief, and we feel comfortable telling people. So I went to my program director and I said, "Hey, I'm pregnant." And there wasn't much like celebratory
Yeah.
words.
Yeah.
It was more just kind of this like bewildered look, like, I was the first non-chief to get pregnant.
Oh.
I was third year at the time out of 5 years. So they had only ever had fifth years get pregnant, and fifth years have a little bit more flexibility with their schedule.
Mm.
So I just told him, like, I'll just take my 3 weeks of vacation after I deliver, and that'll be it. And that's what happened.
Wow. How did that feel going back to work at, I guess, 4 weeks postpartum for your body, for your mind?
You know, Joan, I don't even remember that period of my life.
Yeah.
I just was like in total survival mode,
Yeah.
and I was horribly guilty
Mm.
about leaving my husband with our kind of colicky baby who only wanted to eat off of me and
Oh,
not the
no.
bottle.
Yeah.
And just without being TMI, the pelvic floor situation was not great going
Hmm.
back on your feet all day.
Yeah.
So I don't know, but I didn't have like another choice. So
Yeah.
I just packed my Tylenol and ibuprofen and just went back to work.
Yeah. Okay. So you're telling me this story, and this is not the program that you decided to leave. This is the program you gritted your way all the way through to the end.
And that I would retrospectively say gave me a wonderful education. And it was no walk in the park, but
Yeah.
overall, I'm very grateful for my residency program and my co-residents and my attendings. And overall, it's a very positive but tough experience.
Right. So then, what happens next? You go to fellowship.
So, facial plastic and reconstructive surgery fellowships are quite competitive. I interviewed at 14 programs. I ranked 13 of them, and I matched at my number three spot.
Wow.
And so I was pretty excited. I was like, okay, landed in the top five. Um, it was most facial plastic surgery fellowships are like kind of almost an apprenticeship where you're with one person for full 12 months and you learn the business side, you learn the kind of um, running a surgery center. It's all these extra things that you don't get to learn in residency because you're in a big hospital. Now
Mm.
you're in kind of this more like private practice model. So we moved to Tennessee. I'm so excited. I'm done with residency. Now it's on to the, easy peasy fellowship. Um, I like right out of the gates, it was like, whoa, I think there might be a personality issue here. Like,
Mm.
I'm water and they are oil, and I don't know how well we're going to mix.
Yeah.
But I was like, I can put up with stuff, I can get through it. And so I would say like the first month was fine, and then things started to just get weird. Like, the biggest weird part was I like wasn't allowed to ask questions.
Oh no, but you're a learner. So
Yeah, I'm a learner.
what?
I'm literally here to learn. And I would say in residency, you're scrubbed into these big long cases the whole time. You're just talking, chit-chatting with your attendings about like, well, why are we doing this? Or why are we doing that? Or what suture do you use there? Or what paper should I read tonight? Or,
Yeah.
fellowship was totally different. It was like you shut your mouth, you don't talk, you don't ask questions. You only read my papers and my chapters.
Mm.
don't don't let me walk past your desk and see a publication from someone else.
Oh my.
And I was like, what is going on? That is actually wrong, sir. That is not good.
Yeah.
And then I, for anybody who's taken the Enneagram test, I'm an eight, which is a
Mm.
challenger.
Hmm.
So I just like some people in that situation would just duck their head and ride out the 12 months. But I was not. I was going to challenge that person and I was going to keep asking questions because I decided to come here. I am basically working for free. I mean, not exactly free, but this tiny little paycheck. So with that tiny little paycheck, you are required to teach me.
Yeah.
That's why I'm here. So I pushed it, and some might say I pushed it too much. And so then we started to get into personality conflicts and um there's a whole weird dynamic between him and his wife, and
Uh-oh.
they were. basically telling the team to like not talk with me. Don't even eat in the lunchroom. Like if she's in the lunchroom eating, don't go in there and eat your lunch. Don't chitty chat with her in the hallways. So things just like continued to devolve.
Yeah.
And I remember one day I came in and my desk was down. Like initially my desk was in like the main workroom, like staff wise, next to the nurses, and which was nice because then I could hear like what patients were coming in. Um, I wouldn't miss anything. I was kind of right there in the mix. And one day I came in and my desk had been moved upstairs, which there really was nothing upstairs. There were some like offices, some bathrooms. And I was like, well, that's weird. I sat upstairs away from everybody, isolated.
Mm.
I asked, I missed a lot of patient visits because I was upstairs and no one would call up to tell me, hey, so and so's here. Can you go take out their stitches? So I was like, wow, this is an interesting move that they made by moving my desk upstairs. Like it's a very symbolic thing.
Yeah.
Um, and then I don't know if you want me to go on, but felt very unwelcoming. Like, don't ask me questions, don't talk to me, don't even sit here, don't converse with my staff. And so I was pretty hurt by that. Like,
Yeah.
why am I even here? The overlay was that it was 2020, 2021. So I
Oh,
would
wow.
say everyone was kind of craving human interaction. And so again, I challenged that. I would try to eat lunch with people. I would chitty chat with them in the hallways. I wasn't going to just come to work and not talk to anybody. I wasn't going to do that. And so we had several sit down meetings where it was him, his wife, and I, or like a staff member. He was always so weird about like there had to be an extra person in the room
Mm.
to witness things.
Okay.
And then the other weird thing is that whenever we would have these sit down meetings where he would review my performance or my attitude or whatever, he would make me put my phone on a different level of the building. So if we met on the first floor, he'd have me put my phone upstairs. If we
Oh,
met
my.
upstairs, he'd have. So it was just like complete lack of trust.
Yes. He's thinking you're going to record it or something, I assume.
Yeah.
Yeah.
And the lack of trust was strictly like like a personal thing.
Mm.
It wasn't like as a doctor, physician, provider thing. Like I had keys to the office. I saw a lot of his post-ops like when he was out of town or on weekends. I mean, I still was doing all of the like doctor tasks. Like I still prescribed all the post-op medications and
Yeah.
participated in surgery. It was just that he didn't like me as a person, is what I felt.
Wow.
And I would say that during residency, I was a well-liked resident. So this was all like very new to me. Um, and so for the first like half of the fellowship, the first 6 months, I was like, what the hell am I doing wrong here? Like,
Mm. Yeah.
am I like what am I what I just kept coming home at night thinking like, what is going on?
Yeah.
And then I started to reach out to some people in the field of facial plastic surgery, just saying like, hey, help. I am in this weird situation. I really do not enjoy my fellowship. He's treating me like garbage. I don't think he will sign any of my paperwork when I'm done.
Mm. Yes.
I was starting to get those vibes. So what should I do? And all of these people were like, I'm busy. Don't involve me. I have no advice. Either just stick it out or quit and do another fellowship like next year.
Mm.
So no one was really helpful in terms of like, well, maybe I could call him. And all these people knew him because it's such a small world.
Yeah. So these are his colleagues, and they're like, I don't want to get involved.
Yeah.
Yeah.
Yes. Leave me alone. Quit emailing me, quit calling me.
Mm,
And so, I mean, there's lots of examples of just, I mean, someone listening to this might be like, what? Yeah, this is like very vanilla, basic things. But towards the spring, so academic year is like July to July
yeah.
in the US. So towards the spring, um, I was scheduled to be gone for a week. In our contract, in our fellow contract, it said we got 2 weeks of vacation. This was another challenging personality trait of mine that apparently no fellow had ever taken vacation before. Well, I was like, well, I'm going to take my 2 weeks because I'm making like 24,000. This is ridiculous. And I want to go back to Kansas City and look for houses.
Hmm.
So they finally agreed to let me take a week off. Before that week off, I said, hey, can you sign this piece of paper for my Kansas medical license application? And he said, oh, I'll sign that when you get back, like next week. And I was like, well, sir, please, I have it right here. Can you just sign it?
Hmm.
And he basically said no. And I was like, okay, I'm reading the room. I don't think you're going to sign this at all.
Mm,
I actually don't think you'll sign my fellowship paperwork when I'm done because things were just so icky between us.
yeah.
And so I forget the details exactly, but I left that afternoon. He sent me some email that said I was on formal probation.
For what?
I don't know.
Oh no.
And so then we just left. We left that night, or I think the next morning. We like packed our entire apartment up and just moved back to Kansas City. And then a while later, I just sent him an email saying I resign effective immediately.
Mm.
It was just this whole weird situation. We never talked again.
How did that feel? Like I'm imagining you've shared you were an athlete from a young age, very gritty, very push through kind of personality and Enneagram 8, so like fight to the end. Was that like what was that like to decide that this one it's time to walk away? Because a lot of people can have stories in their mind, whether it sounds like you made an extremely wise choice, just to say. And a lot of people would have ideas about quitting or about whatever. Like, what was that like to actually make that decision? Was it hard? Was it easy by the end? Like, you know?
I will say I did a lot of research before I decided to quit
Mm-hmm.
in terms of like legally or like scope of practice wise, what does this mean? You
Right.
know, I had finished a residency
Yeah.
and I was board eligible.
Okay.
I wasn't yet board certified because with surgery in the US, you have to take written and oral boards. I had already taken my written boards at this point, and I was already scheduled for my oral boards, which I was, as an eight, I was confident I would pass them.
Yes.
Um, and I had done quite a bit of research through just reading online. I hadn't yet gotten my Kansas license, but that was my biggest question
Mm.
was, can I still get my Kansas license if I quit my fellowship? My other question was more rhetoric. It was like, will patients, like even
Right.
still, I feel a little bit weird telling this story because I don't want patients to doubt my skill set.
Yeah.
So I didn't tell this story for a while because I opened my own business and I didn't want patients to not come to me.
Mm-hmm.
But I said, will patients not, will they look at me differently if I quit? Because I didn't want to live with like this like thought that I was like hiding something or lying.
Mm.
And so I told myself that if I really do quit, and people ask me about it, I have to tell them the truth.
Mm.
Like that's what they deserve as a patient.
Yeah.
And so I mulled over all that for, probably 6 months before I actually decided to quit. So I felt confident enough to do it, but it still was really hard.
Yeah.
Just like this like horrible pit in my stomach. I think that was like the first real like bout of anxiety in
Mm.
my life that I went through.
Yeah.
Just feeling like your heart was racing, you feel like you're gonna pass out. And I still kind of get that pit in my stomach when I like think back to going to work and being in the parking lot,
Mm.
picturing my desk there. But now being a few years out, it's I am so proud of myself for making that decision.
Yeah. Mm. Did it change your like perception of yourself that year and making that choice?
I think it helped me prove to myself that you really can do anything.
Mm. Hmm.
And you are your own advocate. Like, no one is coming to your rescue.
Right.
Everything that is important to you, you have to fight for. And for me, being treated with respect and being taught when you're in an educational environment,
Yeah.
those are things you have to fight for. Now, what's weird, and I've not talked about any of this, but after I quit, the story gets weirder.
Tell me.
So I filed a formal complaint to
Mm.
the like basically the overseeing body of all these fellowships. I wrote this long letter that I tried to make as objective as possible with all my complaints about my fellowship, and I said that you guys should do a formal review of his fellowship and potentially suspend it or whatever. I sent it to every board member that I could find their email address, and I received not a single response back for a month.
Wow.
And then I emailed them again because I'm an eight. And a couple of them said, please don't email me again. Um, and then they apparently did some investigation into it. And then like a year later, they said they found no issues with the fellowship, but that was only at me urging continued feedback.
Yeah.
And the what is it, the executive, whatever of the organization called me several times on the phone, basically to ask me to just stop making an ordeal about it. Which is interesting because he's not a physician. And so I'm like, sir,
Mm.
politely, you have no idea what I went through.
Yeah.
And like, this was supposed to be like the capstone to my education. And it was just this like steaming pile of SHIT that I ended with.
Yeah.
Like, after all this like training and learning and uh, just, you invest in yourself so much when you go to medical school, residency. Like, it was something I really look forward to. And it was, if anything, it was just a disappointment that I ended up there.
To say the least. I'm curious, like fellowships, I don't even know what's true in Canada because I know about residency, but then fellowships, I thought they were still associated with like a university or like a college, I think is what you call, like is this separate from any given educational institution?
So fellowships in the US fall into two categories.
Okay.
There are those that are under the purview of the ACGME, which is like this big organization that keeps all residency programs
Okay.
on track.
Yeah.
And then there are non-ACGME fellowships. And it's just kind of however that field evolved. Um,
Mm.
all the facial plastic surgery fellowships are in the more unregulated category.
Oh dear.
That's why I said they're more like apprenticeships.
Yeah.
They don't have like a big overseeing third body that accredits them. They have these like little organizations that do that, which is problematic in that they're all kind of buddy buddy with each other.
Yeah.
So if there is a problem with someone, the folks investigating it may be biased towards one of the parties that they're investigating. Um, so to answer your
That's yeah.
question, yeah.
That's right because it's like just even the notion that it didn't sound like there was sort of a formal process. If I just know that an academic organization is meant to have a formal process if a learner has a concern, right? It's feedback should be both ways in the best of times and especially in the worst of times. So it sounds like that wasn't so much your experience with this particular organization at all. Oh boy. And then did you also mention that you were fighting with this organization directly, trying to do like the formal thing to say, "Hey, I have a serious concern, thinking of the next learner," and all of that. Was there also like a public facing element to? Did you say something about like going on social media or something, or did I misremember?
Well, early on, I didn't say anything
Yeah,
because I was nervous, Nelly, about one patient's
yeah,
hearing about this whole story. Again, if they asked me directly, certainly I was going to tell them the truth, but I also wasn't going to broadcast it.
yeah.
And then I was also fearful of him and his wife coming after me legally if I were to talk about anything. The story that did go viral was a story about me in medical school
Oh, okay.
where I was slapped by an attending in the face
Oh my
and
goodness.
which I think that instance, that story or that occurrence, um, again, help our own experiences inform our opinions about things. And so the fact that I had been physically slapped by someone,
Yeah.
I think helped me quit my fellowship. As weird as that
Nope.
goes.
I see the line for sure. Yeah.
hmm So that was a
Okay.
different incident. But yeah, surgical training, if we could loop back,
Oh,
is
geez,
not
Louise.
is not for the faint of heart. There's just all these crazy stories that we have. And, when you're the one going through it, you feel like it's your fault.
Mm,
You feel like you're the rotten egg. You feel like you're the only one. But then when you talk about things to other people, they're like, oh my God, that happened to me. You know?
yeah. I'm curious, speaking of that, so now you're obviously being more open, not only of that original slapping story, geez Louise, but also like, all these different stories, especially this last one that was really fraught and emotionally challenging. Um, what does it mean to you to be sharing your story, like when you have now that you've become more open about your experience with the fellowship?
I mean, for me, it's cathartic
Mm-hmm.
to get it out and just say it. And I think that it makes me feel like I'm not a liar.
Mm,
There was some delay, increased explanation that I had to go through with getting my state license, with getting credentialed at the nearby hospital. There was all this like extra stuff that I had to do, and I was so open about all of that. And so, if anything, talking about it just makes me feel better that I'm not like hiding something from the public.
yeah.
And then I think it makes me feel like I'm hopefully serving as some type of resource for people who are going through something similar.
Yeah.
Because when I Googled how to quit your fellowship or what happens if you quit your fellowship or all these, we just sit in bed and go down these long rabbit holes, I couldn't find anything like that. And so I have had people reach out to me on social media about some of their own things that they're going through. And every situation is completely different. So it's not like I can guide them
Yeah.
completely. But I do think just knowing that there are options is helpful for other trainees.
Mm, yeah. Would you say that is like, what would you say are some of the main messages that you wish you had heard that would have helped it feel different? Like you still would have gone through that experience, I guess, but like, what do you wish that someone had been alongside you telling you? You have choices being a huge one.
I mean, even in the world of facial plastic surgery, which is very small, I have talked to so many people who hated their fellowships,
Mm,
which is interesting
yeah.
because it's like, social media is this highlight reel. We put out these stories and posts, and you just think that, like, oh, everybody has these like amazing experiences and everybody else's life is perfect, and I'm the only one struggling. And so, if anything, it's just validating.
Yeah. Could you ever see yourself, say you continue with your business and at some point in the future, could you see yourself offering a fellowship and doing it differently?
Maybe.
Yeah.
Maybe. I mean, I I don't know. I like to be in total control of everything.
Hmm.
And so certainly I would love to contribute to education and teaching, but fellows specifically, you have to give up a fair amount of the surgery so that the fellow can learn.
Yeah.
And with cosmetic surgery, it gets tricky because it's like the patient is really paying for you
Hmm.
and your expertise and your hands and your skill. And so maybe, but I'm more interested in mentoring medical students, pre-meds, maybe residents.
Yeah.
Hmm.
Have you had some experience doing that? I know you're early on, so.
Yeah, not formally. We
Hmm.
do allow students to shadow on occasion and watch, but obviously I'm not affiliated with their program. They don't get credit.
Hmm.
And then if they're a resident, they are not like licensed,
Yeah.
with us, so they can't scrub in with me.
Mm. What can you see then, sort of a future question? How can you see your approach to learners being different than what would you want to take with you that are like some things that were really valuable, of how you were treated, and what are some things you'd want to do differently if in the future you decide to start teaching yourself?
I mean, the other component of this, which I didn't bring up, is that he wasn't just bad to me.
Yeah.
I would say that he wasn't great to his employees.
Hmm.
And so it really showed me what I don't want to be as an employer
Mm.
and a leader of a team. And so I've already been able to take some of those things and
Yeah.
I try to be the best leader I can every day, although it's kind of like parenting. You try to be the best mom every day, and some days you're great, and some days you're not.
Yeah.
But if you just try to get a little bit better every day, you know, um, I think learner wise, anytime you have a student, I think curiosity, question asking, discussion, that is at the heart of learning.
Mm.
And so those are the biggest things that I encourage of students or, observers that we have, ask me questions constantly. Like if you want, I can send you some papers or, I just think the curiosity component is something that is critical. And you
Yeah.
should not squelch that as the teacher.
That is just a very bizarre teaching style, is the no questions teaching style. That really would limit someone's learning, wouldn't it? Oh my gosh. I'd love to hear then, yeah, how you've taken the lessons and practically applied them to your employees. Like, um, what what did you establish as a part of your like business culture that you feel like is more authentic and human to you versus the way you've seen other businesses run, including that fellowship?
The first is that the vernacular that we use is important. I
Mm.
don't, we're a team here because we really are a team.
Yeah.
I'm, I don't like it when they call me their boss or their employer. We're all a team and we're all like, responsibility wise, we all have different responsibilities. But when it comes to the way that we all work together, we're all on the same playing field.
Mm.
We're not this militant hierarchical system where someone is above or more important than somebody else. Yes, we do have all different responsibilities, but we are all here to support one another. So we're all a team and we're all going to be supportive of one another. And that is, I think I have the best, I'm biased, but I think we have the best team here at my office because the amount of support and friendship and camaraderie that we have really shows through with how things, work day to day.
Yeah. It's like non-hierarchical is like I guess one term for that versus I clocked that um the person that you did your fellowship with, I don't know if you had to call him sir or if you're just saying sir so you don't say his name, but like is that part of the culture even just more generally in surgery where you call your superiors, sir. That feels very extremely hierarchical to me. So I was curious about that.
Yeah, and that's pretty common in the world of surgery, at least where I
Okay.
trained. Um, yeah, I don't want to say his name. I mean, you can look it
No,
up
no,
online,
no.
but I'm just
Yeah,
trying
it's
not
all
to say
good.
his name.
Yeah.
The other thing here at the office is I don't let my team call me Dr. Umstead. I'm Lauren. I
Mm,
actually prefer patients to call me Lauren too. I think it's kind of weird that I also don't really wear a white coat often.
yeah.
It's just weird to me for some reason.
Mm. I wonder if I think there's so many reasons people can decide how they want to be called. One thing I wonder is if it feels vulnerable for you to show up as your true self in a profession that feels like it has so many expectations that where you're supposed to hide parts of your true self. Um, but it sounds like you've created for yourself an environment where you can feel, I don't want to speak for you, but do you feel more comfortable being Lauren in the environment you created for yourself?
Yeah, maybe that's it.
Yeah.
Yeah, I don't know. I just want to show up to work every day and be me.
Yeah. Oh, the dream.
The dream.
That's so cool that you've like created that for yourself, especially off the back of, experiences that you could have, gotten deep into the brainwashing of the experiences you had before and say, well, that's not possible. I guess I'm supposed to just, you know, deny myself and instead follow this cookie cutter mold. But you did the opposite of that.
Yeah. Yeah.
It's the eight in you. It must be.
Yeah.
Yeah.
It's the eight in me. Yeah.
Yeah. um, any other like lessons learned or pieces like what is the advice just more generally for people who are learners who are in the midst of these systems that we know do not take our humanity into account. Like so far in this story, I have heard direct examples where for even just on a basic level, even the places where people were nicer, the system itself didn't take your humanity into account would be my perspective on offering someone 3 days of maternity leave or paternity leave. That's a little bit bumping up against what perhaps the human body would prefer to have happen after a baby comes into your life. So like there's the systemic policy pieces, and then you've described some pieces that were like another human not treating you as human, which for example, being slapped by someone, probably not. And then just your whole experience in fellowship. Like these sound like the person has to have to be forgetting your humanity in order to treat you that way, right? And so
I think it's
yeah, go on.
I think it's really hard because and I hate that I'm about to say this, but you have to be able to tolerate some amount
Mm,
of discrimination by the system, mistreatment by other humans to actually make it across the finish line.
because it's how it is right now. Like this is what the system we're in.
And I hate that I'm saying that out loud.
Mm,
I think at a certain point, you start to get an idea of what you should tolerate and what you shouldn't tolerate.
mm,
Residency is never going to be like easy.
mm.
So you kind of have to put up with the hour, work hours, the suboptimal maternity leave compared to your friends that don't work in healthcare if you decide to have a baby when you're training. Um, but if someone is just screaming at you in the
Right.
operating room and calling you, mean names in front of other people and publicly humiliating you, you have to kind of have the emotional intelligence to say, well, let's just get through this surgery because the patient we're both scrubbed in
Yeah.
and the patient comes first always. And then perhaps maybe I could go to this person's office later this evening and say, you know what, ma'am, sir, I think that our case went well today, but it was a little bit hard for me to focus when you were publicly humiliating me in front of the nurse and the
Yeah.
nurse anesthetist. But that's tricky because there are people that will be receptive to that and may treat you better. And then there are people out there that will, retaliate if you do that. And so I think if a PGY2 were to come up to me, a second year resident were to come up to me and say, like, I'm really struggling with this one attending, I would say just keep your mouth shut for a while, keep your head down, keep working. Try to get a sense of if that person might be receptive to you approaching them in private, kindly, and asking them politely to maybe change the way they talk to you.
Mm-hmm.
Because I did have that happen. I had one attending that wasn't just personality wise was a little bit offensive. And in residency, I said, sir, I'm just not going to let you talk to me like that. So I'm
Mm,
going to walk out of the room and walk back in. We'll start the conversation over again.
nice.
I did that when I was a third year resident. And from that point forward, he treated me beautifully and we got along perfectly. Whereas I had another attending, interesting, these are all male, who I just kind of got to know his personality and I realized that he probably wouldn't accept anything like that. And so I just let him say mean things to me.
Mm,
And I've said this before online. I put on this like metaphorical raincoat
yeah.
when I was scrubbed in with him and I just let those mean comments like just run off of my rain jacket. And I'm a very visual person. I think I just visualized the raincoat and the rainwater dripping onto the floor.
Yeah.
And I was like, I'm
Wow.
not going to let that rainwater get my scrubs wet today.
Mm, that's a powerful image. Um, I don't know if you know RuPaul's Drag Race at all, but okay, do you? Okay. It makes me think about there was a drag queen, I think it was Jinx Monsoon, doesn't matter. And part of that show, sorry to equivocate your experience to a drag race reality show,
No,
but
I
this is
love
what
it.
comes to me. They get judged, right? About like and who's going to get eliminated that week about like how good they were at the challenge. And the I think it was Jinx. She would always be like, water off a duck's back, water off a duck's back." Like like she was being a duck rather than having a raincoat. But there's something about repeating to yourself like, say there's a force, whether whatever, say there's something person and the way they're speaking, you've made the conscious choice not to set like an outward boundary. You actually still have the option of setting an inward boundary, like you were creating like a embodied metaphorical boundary of like, this person's saying words out of their mouth but they're not entering my soul. And I just think that's really potent as well. Actually, both of those are like very pragmatic examples of how to handle those sorts of situations.
Well, and it's tough because you still have to listen to their direction, right? This one attending that I knew wouldn't
Yeah.
take, like you're still operating with them and you have to listen. And I would say surgeons tend to be pretty passive aggressive. And so a lot of times
Mm.
uh, their mean comments are intertwined with corrections in your surgical technique,
Like
which is what
helpful
we're there
advice.
for.
Yeah.
Yeah,
Shoot.
so it's like you kind of have to
Mm.
absorb what they're saying in some sense, but then ignore some of the other stuff. And
Mm.
especially in days when you're tired, you've not eaten, you're hangry, so to speak.
Yeah.
Those, man, sometimes it's tough. So it's hard for me to give really definitive, solid advice to trainees.
Yeah. I think those were two solid pieces, right? Because like, um, it's a collective problem, and so each of us can offer some collective pieces. So with that, we're actually almost at the end of our time talking together. I was wondering more broadly then. So like that was for trainees, but people listening, some of them are trainees, and many of them have finished their training, and they're kind of just they're out in the workforce and reflecting back perhaps on their experiences through you sharing yours. But I find people who listen to this podcast are yearning to feel a more sense of authentic self in their workplace. They're wishing they could be Lauren, their version of Lauren instead of Dr. Whoever. Um, I'm wondering if you have any like words of wisdom of advice for those that are like struggling with that burnout and feeling dehumanized working in healthcare now.
Oh, Joan, that was a hard question. I mean, this is probably an unexpected answer, but I think that social media has really helped me like be myself.
Mm,
And so let's back up just a little bit. I opened my own business. I had no money to market, so I market on social media, which is incredibly helpful. It's no charge, and you put yourself out there, and people call your office for an appointment. I mean, it's wild. Um, and when I first started making videos and advertising our business and myself, I would like make sure my hair was perfect and my makeup was done and I had perfect lighting, and I would re-record things over and over and over again and get the language perfect. And I've had things like written out behind my phone. And out of sheer need, volume-wise, because I got busier with work, I just decided if I want to put myself out there as much as I do, I just have to turn on my phone and be myself. And I have to use my own language that I normally use. I don't have time to
Hmm.
like rehearse all this stuff. I, as a surgeon, rarely have my hair and makeup done. So I'm just going to start recording my videos like the normal me,
Yeah.
Beyonce, like I woke up like this. And so I think that bled into all the other stuff. It was almost kind of unintentional. Um, and then reflecting a little bit back onto my fellowship and trying to be a better boss than he and his wife were to their employees. Um, making it seem not hierarchical is a huge thing for me at our office. We're all a team.
Mm, I love it.
And so that's where the Lauren came from. The girls here are like, if they call me Dr. Umstead on accident, I'm like, stop, don't call me that. Yeah. So, I mean, the burnout and the dehumanizing part of it, I feel very fortunate in that I'm solo private practice. I'm my own boss. I think scheduling is a huge component of that, especially with my friends who are in other fields of medicine, because they are not given the ability to control their schedule. With new patients, I spend an entire hour,
Mm,
which helps with me not getting burned out. But my friend who's a dermatologist and works for a big dermatology practice, like, I think a lot of her burnout comes from the fact that she has to see X number of patients a day.
yeah.
And so if there is the ability to work into your contract or renegotiate your schedule and protecting your time with patients,
Mm,
I think that is one thing, although I don't know how doable that is for so many physicians.
mm. It's fascinating how people can get creative. There's like real restrictions, and I'm always interested in hearing how people get creative. So certainly when you're working for yourself, you could have a different mindset where you're like, I'm my own boss and I'm the breadwinner here. So I have to push myself. But I'm hearing instead you're like, I'm my own boss. I get to actually design a workflow that works for me, and then that's how I'm going to actually have a sustainable practice in my business. Like it, any environment someone can turn into like, oh, I have no choice but I have to follow something that's against what my body and brain needs, or like you're doing actually something that serves you, and through that serves your patient, serves your team, means you're going to make more money in the long term because you'll be there in the long term to make money, right?
It is a marathon, and
Yeah.
I'm trying to enjoy most days that I'm here. And
Yeah.
if I'm overwhelmed, I need to look forward into my schedule a few months and block some more time out.
Nice. Yes. Such that okay, everyone please listen. That sounds like a very specific, but it is like one of the best strategies. It's so practical and it's so real. You don't know this about me, Lauren, yet, but I'm like obsessed with schedules and them having a lot of space in them. So I'm just gonna really highlight that particular strategy is we think then we gotta work harder or get more efficient. It's like, no, what if we actually just gave ourselves some space?
Yeah, and then, if you're feeling, say you block some time out a month from now, and then you actually are hungry and want to see patients that week, then you can always backfill your schedule.
Yeah, there's always more work that can come in. Yeah.
Yes. Or you can just catch up on admin stuff,
Mm-hmm.
or I don't know, go for a walk, maybe.
Read a book. Imagine
Read a book.
that.
Yeah.
So for those listening, do you have do you want to share where people can find you, like on social media or any platforms that you'd like people to check you out?
Instagram and Facebook is Lauren Umstead, Umstattd. TikTok is really big, although my DMs are massively flooded and I never check those.
Okay.
And then our website is baseleewood.com. So that's another way to look at our work or send something through to our office.
And as a Swiftie, I just wanted to highlight again, you're in the Kansas City area. So if you ever happen to run into a certain Miss Taylor Swift someday, just say hi for me. Is that on the street
Will
or
do.
wherever? Go to the same grocery store or whatever.
Yeah, we all of us Kansas Cityans, we hope to see her walking down the street. But I think she's got people to go to the grocery store
I
for her.
don't think she just strolls down the street anymore. I don't think that's safe for her, actually.
Yeah, I don't think so.
Oh, all right. Well, thank you so much for sharing so openly and honestly and like vulnerably about like some really challenging experiences. Like you said, challenging is a good word for them. I know people listening will appreciate it and relate in their own way. Yeah. So thanks so much for coming on.
Thanks, Joan. It was great chatting.
And for everyone listening, thanks for listening, and we'll talk to you next week. Bye. I would love to take this work deeper with you. Visit joanchanmd.com today and discover my growing menu of options for restorative medical education to suit your learning needs. I offer one-on-one coaching, customized workshops, and self-study courses that allow you to connect not only with my work on a deeper level, but also with other healthcare humans just like you. So if you want to start humanizing your work in healthcare to a deeper level and do it in community with others, please visit joanchanmd.com and find those options and what fits you and your life today.